Heart attacks. These are incredibly common. If someone you know is having the symptoms, how can you tell? Well, in my clinical practice, I've even seen people as young as in their 20s have bona fide heart attacks. This is a big deal. You do not want to miss these signs. Let's talk about it. First of all, heart attacks are incredibly underdiagnosed, especially in some groups such as women. This makes recognition of these signs really, really important. Now, there are some associated risk factors. We all know that if you have high blood pressure, diabetes, high cholesterol, or a family history, you're at higher risk. And if you smoke, you really want to quit. That's an easy risk factor to avoid. But let's talk about the obvious signs. We all know that heart attack is associated with chest pain, or chest pain that radiates down the arm, or you get shortness of breath or palpitations and sweatiness. But some of the atypical symptoms, which are more common in women, may not be quite so obvious. Really weird one, reflux symptoms. I actually had a lady come to me in the hospital and said she just wanted something for her reflux. She was having a full-on heart attack. I could not believe it, but we got her treated and we saved her life. Also symptoms like dizziness and nausea and some throat pain. Again, these are atypical signs. You got to be thinking about it so you can take the appropriate action. So what's the appropriate action? Call 911 if you're in the United States. If you're in the UK, call 999. I used to live there, so I remember well. But you got to get these people to an emergency room ASAP. No delay. Do not pass go. Do not collect $200. Go straight to the hospital. They've got to see you and treat it and bust that clot that's causing the heart attack. Call the ambulance immediately. In the meantime, if you're at risk, you want to do some common sense things that are going to reduce that risk. Number one, lifestyle changes. And this is going to be obvious. You got to get active. You got to get off that chair. You got to increase your activity level and exercise. Number two, diet. All right, I cannot talk about this enough. Proper diet is essential, which I talk about in my other videos, so I'm not going to delve into it too much here. Number three, might be obvious, but stress. I've had patients come to me that are under so much stress, they actually created the conditions for a heart attack. We had to send them to the cath lab. Believe it or not, stress can cause this. Number four, stop smoking. This is easy, difficult, but also easy to modify if you're in a proper treatment program. I look forward to your comments. Follow me for more. This is a really important video, and there's going to be plenty like it coming soon. Stay tuned.